Hello friends, in this video I'm going to show you how you can dislodge fluffy cortex from close to the equator of the bag with IOL rotation. I'm going to demonstrate this in a patient who had a total traumatic cataract. A toric IOL was planned for this patient. The surgery is being done under topical anesthesia. The cortex was extremely fluffy in nature. This was just a 32-year-old individual who had a blunt trauma to the eye and subsequently developed this total cataract. The capsular excision is performed with the help of a uterine forceps after adequately staining the anterior capsule with trypan blue. Please note that when I do cortical cleavage hydrodissection, because the cortex is so fluffy, there's a breakthrough of fluid right through the cortex. So this is actually a very fluffy cortex, and therefore I decided to aspirate this with the help of a coaxial IA cannula itself and did not have to use phaco emulsification at all in this patient. Now the problem with this fluffy cortex is that it's not cohesive and it just seems to come off in small bits like little clouds. And therefore it is not possible to hold it like a sticky cortex and then pull it out from the equator of the capsular bag. Now this was the problem I faced while I was trying to clean the equator of the capsular bag off the fluffy cortex, and I found that the hold of the vacuum was not sufficient to hold on to this soft fluffy matter and pull it out. The capsular excision also being around 5.5 millimeters in size did not allow me a total access to the periphery of the equator of the capsular bag. And on retracting the iris, I saw that there was quite a lot of fluffy cortex in the periphery, and I tried to remove most of it. However, there was also a large area or a considerable area in which this fluffy cortex was still remaining in the periphery, which was not easily dislodged. So instead of trying to fish in the periphery and risk the creation of a zonular dialysis in this young individual, I decided to implant the toric intraocular lens. This is a synergy toric intraocular lens that is being implanted. At this point, let me just show you how you can use the rotation of the IOL to dislodge the cortex. The rotation of the IOL can be done when the IOL is flat in the capsular bag. This will put a lot of pressure on the zonules. Therefore, it is always best to tilt the IOL optic a little bit, and then you can freely rotate the IOL from side to side. This free rotation of the IOL haptics along the equator will dislodge the cortex quite efficiently. And you can see that by this simple maneuver, I'm able to dislodge almost 100% of the cortex, and these fluffy clouds seem to simply float out from the equator, come into the central area, some over the IOL and some underneath the IOL, which is then sufficiently and adequately removed with coaxial IA. This is what I call as a pivot rotation technique, that when you tilt the optic of the IOL, it helps to expand the capsular bag. It also reduces the strain on the zonules, and therefore IOL can be freely rotated without placing any stress on the zonules. In addition, the rotation of the IOL can be done in both the directions because the bag opens out and it's easy to rotate in both directions. The placement of the toric IOL is then confirmed by coinciding the Purkinje 1 and 4 images and seeing that the toric marks are beautifully aligned, and that marks the end of the procedure. Thank you for your attention.